So my name is Sofia Weskamp. I'm a PhD student in Melbourne. I did my pediatric cardiology training in Melbourne as well. And we wanted to dedicate a bit of the cardiac MRI component a bit separate because I think it's the scariest part of this study. I've noticed, at least in the participants that came to Melbourne already, I do blood pressure measurements with the echo, with the exercise test, and with the cardiac MRI. And usually with the cardiac MRI, just before the blood pressure goes to the roof. We're not sure if it is because they don't know what to expect. Some of you have had cardiac MRIs before, some of you haven't. And there's involvement of contrast or dye in your veins, so probably I think that could be the reason as well. So first of all, I want to say that I'm from Argentina. I have, after 22 times losing against the All Blacks, I don't have hard feelings, maybe a little. So magnetic resonance imaging, that's MRI. It's a fancy word to say that we're taking pictures of your body using a magnetic field and radio waves. And the most important thing of MRI is that it gives us a lot of detailed information, a bit more in detail sometimes to ultrasound and CT scans and X-rays, but it is complementary as well. And there is no ionizing radiation like with X-rays. What to expect before having a cardiac MRI? First of all, you will have to complete an MRI questionnaire. As we use a magnet, nothing metal can go inside the magnet, and the magnet is always on. So as you can see, it's very detailed, and we give these questionnaires a while before having the study, because it is really, really important for you to complete it thoroughly and have it as complete as possible, both for the participant, and if you have somebody with you, they have to complete it as well. If there's anything that you don't know, whether you have wires or not, whether you have coils or things like that, it's better to say, I don't know. And then we will go to your files and, and everything you have done in your hospitals and find out. So it's very important to complete this beforehand. The other thing involved in cardiac MRI, apart from holding your breath and having an ECG, is that we tend to use contrast with it, this dye that I was telling you about, and that involves a cannula in your arm. Many people don't like needles. Most of my participants have said that they're used to needles. I always say that if you can avoid any painful procedure, mainly for research, is better. So we have available numbing creams, and they do work. In fact, I'll show you a picture of myself giving birth to my son, and I took some, that's the anesthetist who became my best friend after 40 hours of labor. And I did take with me some numbing cream for my epidural and my cannula, and I didn't feel a thing. So there's ways of getting through that a bit better. So that's what if you haven't had a cardiac MRI before, that's what the scanner looks like. That's at the Children's Hospital. It's like a box with a tunnel in the middle. So when you are there, you have to be really, really still. It's not the most comfortable thing. The MRI machine makes a lot of noise, so you have to be wearing headphones. The cardiac technologists will tell you exactly what to do, and they communicate through the headphones with you. But at the same time, I'll show you another picture. You were wearing this helmet, well, that I was shown before, and it has mirrors, so they can actually be looking at everything in the room. And you can also be watching a movie, mainly during the resting component of the cardiac MRI, if you'd like to, or listen to music if that relaxes you. So that's what it looks like. We use this wrap that goes over your chest, and it looks like you're strapped, but we're actually recording some radio waves for the pictures with that, and that's necessary for the cardiac MRI component. If you choose, so you can choose in this study whether to have all of the cardiac MRI components, maybe just the resting with or without contrast, and you can choose whether or not to have the exercise MRI component. And this is done after the resting component, and will make the table is a bit different, as you can see. So this is one of our participants. So there's a bike attached to the table. We adjust it just before going into the magnet. And what we'll do is make you cycle for about 3 minutes. We put weight on the bike, like we do with the exercise test, but we go half of the weight, because you're lying down, which is a bit different. And we'll make you cycle for 3 minutes, then stop, give you some time to catch your breath, and then hold your breath to get the pictures. And we do that for 3 times if you're a good breath holder. And then that's it. It takes about 15 minutes compared to the resting cardiac MRI, which takes a bit longer, 30 to 45 minutes. So what were we trying to find out with this part of the study? So first of all, describe our own population. So it has been done in the Pediatric Heart Network, which is another registry. We use guidelines and protocols and recommendations for cardiac MRI in congenital heart disease. But it's still evolving, and there are new techniques as well that we're trying to use. So I'll show you a few pictures of what we can see with the cardiac MRI. So we can measure ventricular volume, so how big your heart is in different parts of the cardiac cycle. We can see how well your heart contracts. We can see how thick your heart is. We can see how big your pulmonary arteries are and the flow distribution to each lung. We can see these collateral vessels and actually quantify collateral vessels that we were talking about, these little vessels that form in between the arteries and the pulmonary circulation. So this is what we call a long axis of the heart. So you can see we take a few pictures and then we make a cine, like a movie, to see how it contracts. This is the short axis, like a slice of the heart. And we can see how well it contracts, and we can actually measure and quantify things. And this is when you have contrast. So contrast, this dye is really useful for us. It makes all the main arteries of the body go brighter, so you can see it better. And our idea, so you can see how nice we can see all the vessels. And with this, we can actually assess all the Fontan pathway, looking for clots for Chantal's study. We can see if there's any conduit, any changes in the size of the conduit, compare it with the at time of insertion, the size you had. We can compare aspirin and warfarin. So with the exercise component, we measure more or less the same, but we can actually see the difference between fenestrated versus non-fenestrated. This is a movie of, so when we are doing exercise, of course, the heart rate goes faster. And it has been established now that cardiac MRI is the new gold standard, or the best technique to assess cardiac function and volume quantification during exercise. We can also quantify the impact of the collateral vessels on exercise capacity as well. And just briefly, we're doing this new technique. It has been known for a few years already that in congenital heart disease, we can have a bit of scarring, which is fibrosis in the myocardium. So now with this new technique, we can actually quantify that a bit better. So far in Melbourne, we've had 18 participants with extracardiac Fontan who underwent resting cardiac MRI. We also had a few of AP Fontans, atrial connections. One of them chose not to have contrast, and 13 participants underwent exercise MRI. Remember that not everybody is allowed to have a cardiac MRI. If you have a pacemaker, you won't be able to have that component. which limits our numbers as well. And there's some limitations with the exercise MRI in terms of how tall you are, because we can't have too tall people. Because they hit their knees against the magnet, so yeah, we can't adjust that. So we're still recruiting, and of course, the more we have, the better representation of our population we'll have, and because not everyone can have it, we're kind of asking if you can participate in this component, if you can. And Sydney and New Zealand have started already, so we'll see what we show, and maybe I can give you some of the results next year.